The Himax PLLA is a combination of 150 milligrams of polylactic acid, uncross-linked hyaluronic acid, and also a 0.3% lidocaine. It is placed subdermally. It lasts up to 2.5 years. The aim of this biostimulator is to increase collagen, elasticity, and also the skin thickness. However, the combination of the hyaluronic acid, which is added, gives an instant moisture burst as well as an instant glow. PLLA should be placed in the lifting areas of the face, which is the superior part, also the immobile part. Again, ask your patient to smile in order to make sure that there is no movement in the areas where you're planning to place it so that it does not migrate. Mostly placed in the temple, posterior zygomatic area, preauricular, and over the jawline. The bulk is usually placed in the temple, especially if there's temple hollowing. It can also go slightly into the hairline to get the maximum lift. Generally, it's distributed 2.5 mils in the superior part, 2.5 mils inferior. If you get a better lift and there is more hollowing at the top, rather place 3 mil and use your own discretion in terms of the distribution at the bottom. Lifting manually will give you a good idea where the maximum benefit will be. There are different approaches in terms of entry points. My personal favorite is entering from the midline and going up and both down. First, numb the area where you're going to inject just to give the patient some extra comfort. After cleaning thoroughly with an alcohol swab, make your entry point. It's ideal to work with a 22 gauge cannula. Be sure to stay in the subdermal area. Slow retrograde injections as you come back. For this patient, I'm going to do 2.5 mils in her temple area. You can see the immediate volumization, especially due to the hyaluronic acid. Don't try to force the cannula at any time, just change direction. If you meet too much resistance, the more posterior you work, the better the improvement. Don't inject too close to the entry point, otherwise there will be pooling of product around the entry point. Pull out and change direction. We are still in the subdermal area. For this patient, I'm going to leave a 0.5 ml to wash into the remaining area in the front, which will give her not only an instant glow, but also excellent collagen stimulation. These will be done in micro boluses. The most important part of the procedure for me is the initial massage after doing the procedure. This will ensure that the product is properly dispersed, that there's no pooling of product in certain retrograde areas. I also tell the patient and remind them more than once that it is very important for them to massage the temples, posterior zygomatic area, preauricular, and jaw area 5 times a day for 5 minutes at a time for the next 5 days. You can even set up reminders to make sure that you get the maximum benefit from your treatment.